Hi everyone, my name is Tina and I'm a second-year medical student here at the Medical College of Wisconsin Milwaukee campus. I'm here to present to you the research that I've been working on over the summer with the help of everyone that's listed above. We investigated the association of tobacco smoke and e-cigarette emission exposure with pediatric otitis media recurrence and surgery. Otitis media, OM, is one of the most common inflammatory diseases in young children and a leading cause for medical consultation, antibiotic prescription, and surgery. Prior studies have demonstrated an association between secondhand smoke exposure and OM, specifically with disease recurrence, chronicity, and poorer surgical outcomes. An estimated 41% of children in the U.S. are exposed to secondhand smoke. In recent years, the percentage of adults that smoke in the U.S. has generally declined. However, disparities exist, with smoking increasing or unchanged amongst certain demographics, including those between ages 25 through 44 and those of lower socioeconomic status and education levels. Additionally, smoking products have changed significantly in recent years, particularly with the advent of electronic cigarettes, e-cigs, which were introduced to the U.S. market in 2003. An estimated 8 to 10 million of the 34 million U.S. smokers subsequently smoke e-cigarettes. E-cig use has been associated with respiratory symptoms, increased susceptibility to respiratory infections, and severe inflammatory diseases. Furthermore, in vivo studies have found that pathophysiologic mechanisms overlap those of OM. E-cig use has been associated with increasing the likelihood of subsequent cigarette use, especially in adolescents. Given these changes in trends, current research is lacking regarding potential changes in the contribution of smoke exposure to disease. The aim of this study was to examine the contribution of secondhand smoke exposure, including e-cigarette emissions, to pediatric OM and related surgeries in recent years. We hypothesized that despite these changes in trends and products, the relationship between smoke exposure and OM-related surgery will have persisted. Furthermore, we hypothesized that e-cig emissions will exhibit similar relationships with likelihood and recurrence of OM. To do this, we conducted two methods, including chart review and a review of a national health survey. Electronic health records from 2013 to 2019 were collected for patients ages 2 through 17 who underwent tympanostomy tube insertion, or TTI, at Children's Wisconsin and satellite clinics. Data regarding smoke exposure and ear infections was collected from respondents ages 6 through 17 of the National Health and Nutrition Examination Survey, or NANES, 2017 through 2018. Our chart review results showed that patients exposed to smoke had a greater number of TTIs on average and a higher probability of having a second TTI, with p-values being shown in Figure 1. Several covariates were associated with TTI, including race, ethnicity, sex, asthma, and allergy, p-values being shown in Figure 2. Given these significant associations of the covariates, tree analysis was performed to rank significant predictors of outcomes, demonstrating that while allergy was the strongest predictor of having a second TTI procedure, the relationship of smoke exposure to second TTI persisted among those without allergy or asthma, adjusted for race and sex as seen in Figure 3. Our NANES results showed that exposure to traditional cigarette smoke, or TCS, combined TCS and EE was observed in 36%, 42%, and 9% of children respectively, as seen in Figure 4. Other covariates in e-cigarette exposure were found to be statistically significant in 3 or more cases of OM, as seen in Figures 5 and 6. We concluded that associations persist between secondhand smoke exposure and OM recurrence requiring surgical intervention, despite changes in tobacco products and smoker demographics. We also concluded that e-cig emissions may be a greater predictor of OM than traditional cigarette smoke exposure, and further study is warranted to examine this relationship. Our research supports the use of interventional strategies, such as parental education regarding risk of smoke exposure, including EE, on childhood health. Further research is warranted regarding e-cig emissions and its health implications in children. This work was funded by the Medical College of Wisconsin Department of Otolaryngology. Thank you so much for listening.